As San Antonio, Texas celebrates its 300th anniversary, this booming Texan town ranks as the 7th largest in America. And while it has doubled in size to 1.5 million people in the past 4 decades, San Antonio still runs on a tight-knit alliance of local leaders, community partners, and engaged residents.
We've been called a small town with a lot of people. I think it makes people feel connected to one another.
San Antonio is a city of pragmatic people who get stuff done.
These partnerships are being put to the test as San Antonio struggles to ensure its future success leaves no one behind. Using data to drive action on factors that affect health, partners are working to reduce disparities and foster opportunities with historically marginalized neighborhoods and residents.
You hear that zip code matters, where you live matters, but to actually take that data and show on a map of the city of San Antonio a 20-year difference in life expectancy between one census tract and another one in the same city was a real eye-opener.
I would put that one in really human terms, and I would say that in one neighborhood, a woman can live to see her grandchildren, and in another neighborhood, she will not.
Those disparities really did catalyze the partners to start to say, all right, well, what are we going to do about this? This clearly is not okay.
And we know from years of data, from years of talking to families, that oftentimes its root causes is these social frameworks that really affect whether someone can be well. The work to close the gaps of disparity in our community is something that we will continuously have to be looking at.
We want to make sure that it doesn't matter what part of town you live in, that you have an opportunity to live a healthy lifestyle, to achieve success. The Office of Equity will continue to hold us accountable, along with the citizens who have asked us to really make this a more equitable community.
Pre-K4SA is San Antonio's comprehensive early learning initiative, and it's funded through a voter-approved sales tax increase. I think as a nation we do understand the benefits of early learning, but what I don't know that we understand is how foundational they are to all aspects of learning and lifestyle, including health and wellness.
The journey towards a culture of health has to start at a very early age.
For many families, Pre-K4SA is the first opportunity for them to really be introduced to the benefits of early education.
I think what other communities can learn from San Antonio is that an investment in high-quality early learning is worth it. Our children come in to the program every year well below the national norm, and they leave our program well above the national norm. We have seen the needle move on early learning in 3rd grade, reading in particular. It's because of all the work we're doing across the city together.
The YMCA is the early learning provider for Haven for Hope. Haven for Hope is a campus effort to ensure that everyone that's here dealing with homelessness has a chance of a transformational new start to their life. We found a wonderful niche here on the campus with our 0 to 5-year-old emphasis on kids who otherwise would be at a huge disadvantage as they moved into public schools. We connect with the families on campus, over 2,000 families a year.
I'm glad that you're back, chickens.
Lydia Sanchez and her son Hercules are a great example of how we have tried to create an environment with an early learning center right next door to the family dorm and walking distance to the services she needs to be sure she's taking care of herself. Early learning is a game changer, and it's one that will change the lives of generations.
I think we've become in San Antonio a more results-driven, data-informed community. I think what we're starting to see is more and more people being excited about understanding a more complete picture of our city. SA 2020 is both a community vision developed by our community at large and the nonprofit whose job it is to drive progress towards that community vision.
Public dollars invested versus overarching.
Our job at SA 2020 is to tell a more holistic story of San Antonio, both highlighting successes and making sure that we're checking in on challenges. We're results driven first, really moving ourselves towards this vision we created, and we track that through 61 community indicators. I think the reason that San Antonio collaborates so readily is because we designed what we wanted our future to be together.
This is the Education Success Dashboard.
P16 Plus looks at data and then brings everybody together to figure out what we do about what we're seeing as it pertains to youth outcomes, specifically with education.
All of the Girl Scouts.
Since P16 does its work through partnership, it's important that people can see and visualize and consume the data that's in front of them. And so the dashboards make data easy to understand.
43% of them meet the college readiness standard in math.
When we're talking about the cradle to career pipeline, we're looking at this system that we're trying to orchestrate and understand. When we see these disparities with outcomes, you can either accept that as fact or decide to change it. And San Antonio has chosen to do something about it.
The Whitty Museum's HEB Body Adventure is a 4-story, interactive, permanent exhibition at the museum that focuses on 3 themes: health IQ, empowerment, and wellness. And we're now into the 5th year of data collections. Having data on fruit and vegetable consumption, for example, at a zip code level or physical activity allows us to share that data with the other partners in this city to address very real health inequities in a strategic and powerful localized way. Data is only powerful to the extent that it, 1, tells a story, and 2, gives voice to people in the community.
They call it the school to prison pipeline, where you're getting them in court at a young age. And so you had kids being arrested at school campuses and taken to court. Like, you take them out of school in handcuffs to go before the judge to address their school attendance problems. You could look at the problem and say, this is not working. We don't think kids have truancy problems. We think they have problems that cause them to be truant. And so we decided the court was going to use its resources to go into these communities and try to help everybody we could. I would say 80% of our work in school attendance is not done at the courthouse. We have about 30 juvenile case managers that are assigned to school campuses, and you're getting to the family by approaching it that way so we can identify those issues and get them the help and the support that they need.
We understand that mental illness is not a criminal justice issue. The police are being trained in how to effectively de-escalate conflicts with folks who are mentally ill and also connect people to resources.
San Antonio Police Department has led the innovation with respect to mental health.
The San Antonio Police Department started a mental health unit in 2008 to try to meet the needs of the community that struggles with mental health diagnoses. Some individuals have a mental illness. They didn't choose it. It just happened. And I want them to know that it's safe to call the police department. The police department is there to help serve your needs. I'm heading over to a call requesting officers to come out and do an emergency detention. You're safe, you want to hold my hand? I tried to build a little bit of rapport with her. I just had a lot of difficulty in reaching her. That goes hand in hand with somebody that's in acute psychosis. I was able to make a call to Navigator, go through some quick triage questions. I've got a female in crisis right now, but she does have a diagnosis of schizoaffective disorder.
Is the patient combative in any way?
No, she's just scared.
The Law Enforcement Navigation Center is actually a system-wide coordination for mental health emergency detentions.
Any weapons seized during the call?
No weapons seized. We're going to get you help. We're almost there.
Right. It looks like CHCS Restoration is going to be the closest facility.
Take a deep breath, okay? Take a deep breath. The Restoration Center came to the San Antonio Police Department and said, you know, we want to make law enforcement our priority. They built a one-stop shop that enabled treatment rather than incarceration. All right, so this is a complete mental health crisis. You know, serving the mentally ill population for police departments, it's the future of policing. This is what police departments need.
The city and all partners really came together to address improving parks, adding recreation spaces. Now doing extensions for our beautiful river. How do we extend that and make it more accessible for families?
And now back to cactus arms. Left arm under, right arm over, make your eagle beat.
We've got work we need to do, but we've all come together. We are creating a culture that strives for lifelong health.
A culture of health in San Antonio, for me, looks like a city where you will have an equal opportunity to thrive.
I just have a newfound optimism about what we can do in San Antonio.
San Antonio is not just a community that dreams big, it's a community that does big. When we work together towards common goals, positive community change happens.